America is not alone. The vaccine rollout overseas has hit plenty of road bumps. The World Health Organization is now getting some help from Pfizer to get doses to lower-income countries. NBC News chief foreign correspondent Richard Engel joins us now. Richard, good to have you with us this morning. So tell us more about this program and where these vaccine doses will be going.
So there is an international program called COVAX, and it is the plan to push vaccines, not just the Pfizer vaccine, but the Oxford AstraZeneca vaccine and others as they come online to low-income countries. Because the concern is if they don't get it, the cases will just multiply. And the more cases there are, the more likely you're going to have more and more variants popping up. Now, the COVAX program is now starting. A lot of the drugs that are being produced for COVAX are being produced in India. India is now starting to produce drugs for its own population. It's starting to produce vaccines for COVAX, and it is starting to produce some drugs for sale to other governments so they can start distributing to their people. So an international effort to push these vaccines to where they're needed most, because frankly, in Africa, the vaccination program hasn't even begun. So you still have large sections of the world where they are still looking at this problem, wondering when they can begin vaccinations.
Now, Richard, you mentioned India trying to help with the vaccine rollout. Can you tell us more about how that's going to work and what role they're trying to play?
India is a manufacturing hub. Most of the world's vaccines already are produced in India. A lot of pharmaceuticals, generic drugs that people in the United States buy are made in not necessarily in the United States. So India has always been a supplier of pharmaceuticals, and India is going to be producing a huge amount of the Oxford vaccine, for example, and others. So now that they are putting it out to their own people, that was one of the caveats that the drug companies had. They wanted to be able to say that they're servicing the local community at the same time, if not a little bit before, pushing these vaccines out for global distribution. So the global distribution chains, what we're seeing is that they're starting to work. It's starting to move. And critically, the United States, under President Biden, has just joined this program. Former President Trump, didn't want to participate in the international rollout, wanted it to be more America first, even though many health experts were saying, when you're dealing with a pandemic, there is no America first. You have to cure everybody. Otherwise, the disease keeps circulating, keeps mutating, and keeps getting harder to contain.
Richard, while we have you, let's talk about Portugal. It now has the highest 7-day average of cases in the whole world. So what's happening there, and what kind of restrictions are in place?
Well, they've closed schools there. They're limiting travel between Portugal and here in the UK, and they're blaming it on variants. Portugal is very connected to Brazil. Brazil has a linguistically, historically, culturally, and Brazil has a very aggressive variant that has taken over. South Africa has a variant that is spreading. The UK variant, obviously, is spreading across the United States, and the CDC expects it to be dominant. We were just talking a short while ago about concerns of a California variant. The more virus is out there, the more the chances are that it mutates, and the more the chances are that one of those mutations is favorable for the virus and it catches on and becomes a variant strain.
Richard, appreciate your reporting. Thanks for joining us this morning.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here, and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.